Welcome to this podcast in the Inclusive Diving series. In this podcast, we will talk about some of the medical problems that can develop when scuba diving. We will also consider some additional issues that may occur for those with disabilities. Strategies to mitigate or manage these problems will be considered. So let's get started.
Scuba diving holds an incredible allure, doesn't it? That sensation of weightlessness, the vibrant ecosystems unfolding around you, it's just a profound experience. But, like any adventure, it comes with its own unique demands on the body. So today, we're taking a deep dive into how we can make this breathtaking world not just safe, but genuinely accessible for everyone, regardless of their medical background or physical abilities. Our guide for this journey is a truly groundbreaking resource. The Diver's Guide to Medical Hurdles, Solutions for Safe Submersion. This comprehensive guide was authored by the highly experienced diving physician Dr. Mark Downs and was just published in January 2025. What's particularly significant about this isn't just that it's, a medical text. It's specifically designed for scuba diving instructors. It gives practical solutions and mitigation strategies to personalized dive plans for students, especially those with disabilities. And Dr. Downs' extensive experience working with the UK charity Diveability really grounds this guide in real-world application. Makes a big difference.
Absolutely. And our mission for you, the curious listener, is really to pull out the most important knowledge and insights from this instructor's guide. We'll break down the complex physiological changes and common diving challenges that affect everyone, and then we'll really dig into how specific medical hurdles can be addressed. Our goal is basically to give you a shortcut to being well-informed, helping you understand the why behind crucial safety protocols, and showing how tailored approaches can genuinely open up the underwater world for almost anyone.
Okay, so let's start at the beginning then. Before we even think about specific medical hurdles, what fundamental changes happen to our bodies the moment we simply enter the water and start to descend? It's a surprisingly profound shift, isn't it?
It really is.
Yeah.
Our bodies undergo immediate and quite profound adaptations. The first major one is hydrostatic pressure. As you go deeper, the water pressure increases, right? Which causes the gases in your air-filled spaces, think your lungs, middle ear, sinuses, even your stomach to compress. That's Boyle's law in action. You know that feeling of needing to pop your ears. That's your body reacting to this pressure. It also increases the partial pressures of gases in your lungs, which is where the potential for things like nitrogen narcosis or oxygen toxicity starts. You absolutely have to equalize those air-filled spaces to prevent injury.
Right, equalization. We hear that all the time.
Exactly. Then there are significant cardiovascular changes. The water pressure actually compresses the blood vessels in your arms and legs, pushing blood toward your chest and heart. This is called central blood pooling. This increases the pressure in the large veins near your heart, your central venous pressure, which then boosts the amount of blood your heart pumps with each beat, stroke volume, and overall, your total cardiac output. You'll also experience bradycardia, a natural slowing of your heart rate as your body tries to conserve oxygen, part of the mammalian dive reflex. And interestingly, this central blood pooling also stimulates your kidneys to excrete more urine, a phenomenon called immersion diuresis. It can surprisingly lead to dehydration if you're not careful.
Dehydration, okay. That seems counterintuitive underwater.
It does, yeah. Your respiratory system also works differently. The air you breathe at depth is denser, so it just requires more effort to inhale and exhale. And those higher partial pressures of gases we mentioned can lead to issues like nitrogen narcosis, oxygen toxicity, or decompression sickness. There's even a risk of CO2 retention because your breathing equipment adds resistance. On the musculoskeletal side, the reduced load on your muscles and joints underwater can offer temporary relief from pain and stiffness, which is a real benefit for some divers. But remember, nitrogen is also dissolving into your tissues, which needs careful management during ascent. That's key for DCS prevention.
And temperature, that's a big one too, right?
Oh, thermoregulation is huge. Water conducts heat 20 to 25 times faster than air. That means rapid heat loss. Your body reacts by narrowing blood vessels in your extremities, peripheral vasoconstriction, trying to conserve core heat. And even your wetsuit becomes less effective at depth because the neoprene compresses, reducing its insulation. It's a constant battle against the cold, really. Finally, there are sensory and neurological changes, including nitrogen narcosis leading to impaired judgment and pressure on the inner ear causing dizziness. Psychologically, new divers might feel stress, but for experienced divers, that weightless sensation can actually promote deep relaxation. And frequent divers can even develop long-term adaptations like improved respiratory muscle strength. The body adapts over time.
Okay, so even for a perfectly healthy, experienced diver, the underwater world presents its own unique set of physiological shifts. You might be wondering then, beyond those internal changes, what are the common practical problems that most divers might encounter, even without pre-existing medical conditions? And what practical solutions does Dr. Down's guide offer for those?
That's a great question because practice often meets physiology head-on, doesn't it? The guide breaks down these common hurdles very clearly. First, equalizing pressure. This is absolutely crucial. If you're struggling, equalize early and often. Techniques like swallowing, yawning, or the Valsalva maneuver that's gently blowing out while pinching your nose are key. Always descend slowly. If you can't equalize, stop your descent, ascend a few feet and try again. Don't push through pain.
Good advice. What about mask clearing? Always seems to happen eventually.
It does. Clearing your mask if water gets in. The solution is pretty straightforward. Ensure a proper mask fit, tilt your head back slightly, press the top of the mask firmly against your forehead, and gently exhale through your nose. It sounds simple, but practicing this on the surface before a dive is vital. Makes it less stressful if it happens underwater. Buoyancy control is fundamental to relaxed, safe diving. Use the correct amount of weight and make small, deliberate adjustments with your buoyancy control device, or BCD. Again, practice in shallow water until it becomes second nature. Good buoyancy saves air, protects the reef, everything.
And air management, that's always on people's minds.
For managing air supply, it's all about awareness. Regularly check your gauges, breathe slowly and deeply to conserve air, and always, always plan your dive considering your air consumption rate. Communication underwater relies on standard hand signals. Learn them, practice them with your buddy, and stay close enough to see each other easily.
What about panic? That's a scary one.
Dealing with panic is crucial, and the guide's advice is simple and effective. Stop, think, act. Just pause. Focus on your breathing, slow it down, and signal your buddy immediately. Don't try to handle it alone. For navigation, use an underwater compass. Look for natural landmarks like a big rock or coral formation, and stick close to your buddy. Equipment issues are largely prevented with thorough pre-dive checks, being familiar with your gear, and relying on your buddy for assistance if something goes wrong. Know how their gear works too. If you're cold water diving, wear an appropriate wetsuit or dry suit, layer up, and actively monitor yourself and your buddy for signs of hypothermia. And finally, with marine life, be aware, be respectful, maintain distance, avoid touching anything, and know basic emergency procedures for stings or bites, just in case. It's all about preparation and awareness.
It's clear that preparing for any dive involves understanding these universal challenges. But now here's where Dr. Down's work really shines a light on personalized safety. What does this all mean for someone who might have an existing medical condition or a physical disability? How does the guide help adapt to those realities?
Right, this is key. It's about recognizing that scuba diving places unique physiological stresses on the body that can significantly amplify risks for certain medical conditions. For example, conditions like asthma, cardiovascular diseases, or diabetes aren't just minor inconveniences. They can lead to really serious complications underwater. Imagine impaired breathing or barotrauma becoming life-threatening without immediate medical care available, or how pressure effects can exacerbate existing issues. For instance, even mild ear or sinus problems can severely hinder equalization, leading to pain or injury. Cardiovascular conditions dramatically increase the risk of heart attacks under exertion. Anxiety or panic disorders, which we just touched on, can completely compromise judgment in a critical situation. And chronic conditions like diabetes pose risks of hypoglycemia or dangerously low blood sugar, especially during prolonged or strenuous dives where you're burning more energy.
Okay, so given those potential amplifications, how does the guide, especially considering Dr. Down's work with diveability, tailor solutions for divers with specific impairments?
That's where the adaptive approach really comes in, and it's incredibly empowering. For mobility impairments where moving on the surface or underwater is difficult, the guide suggests specialized adaptive equipment. This could be anything from modified fins or webbed gloves for propulsion to handheld propulsion devices like underwater scooters. The key is often diving with a trained buddy or assistant who truly understands their needs, and participation in specific adaptive training programs designed for these situations.
What about visual impairments? How do you navigate or communicate?
Yeah, for visual impairments, which affect navigation, communication, and recognizing features, divers can use tactile signals like pre-agreed touches on the arm or hand, and maybe audible communication devices if practical. Practicing orientation techniques in controlled environments and having a sighted buddy who acts as a guide describing the environment are absolutely crucial. With hearing impairments impacting communication and the ability to hear warning sounds, solutions involve clear, often exaggerated hand signals, waterproof slates for written communication underwater, and really thorough pre-dive briefings beforehand where all critical information is conveyed visually, maybe using diagrams or models. Finally, for cognitive impairments affecting things like decision-making, memory, or understanding instructions, the approach is clear, concise, and simplified instructions. Having knowledgeable and patient buddy support is essential, along with frequent repetition and practice to reinforce learning and build confidence. It's all about creating tailored support.
What's crucial here, it seems, is that Dr. Down's guide doesn't just list individual solutions. It emphasizes overarching mitigation strategies that apply broadly, creating a comprehensive framework for safety no matter the condition. What are some of those universal strategies?
Exactly. These strategies are paramount because they apply to everyone, but especially when managing specific conditions. First, pre-dive medical assessment. This isn't a one-and-done thing. Regular checkups with physicians trained in diving medicine are vital, especially as you age or if your health changes.
So staying current with your dive physical.
Absolutely. Then, honest self-evaluation. You must understand how your specific condition might impact your dive performance on that particular day, not just wishful thinking. Be realistic about your limits. Condition-specific planning is also critical. For instance, a diver with diabetes might schedule dives for periods when their blood sugar is typically most stable, or someone with asthma would avoid cold, stressful conditions that could trigger an attack.
Planning around the condition makes sense.
Exactly. Proper training is always essential, and for some, this might mean additional training in emergency response or how to effectively use specialized dive computers and safety equipment tailored to their needs. Buddy communication needs to be completely transparent. You must discuss your medical conditions and emergency protocols with your dive buddy before you even get near the water. No surprises. Specialized equipment like full-face masks that allow for voice communication or specific modifications for mobility can make a huge difference in safety and comfort. And finally, emergency preparedness means having a clear plan for evacuation, immediate first aid, and knowing how to access hyperbaric facilities if needed. It's all about proactive prevention and readiness.
Okay, let's zoom in on some of these specific medical hurdles Dr. Downs addresses in detail. First up, thermoregulation in scuba diving. We know water is a fast conductor of heat, but how does the body really struggle to maintain its temperature underwater? Can you unpack that a bit more?
Sure, it's a stark difference from being in air. Like we said, water conducts heat 20 to 25 times faster. This means even if the water feels comfortable at first, your body loses heat much more rapidly through convection. That's where water movement constantly replaces the warmer layer of water near your skin with cooler water. Your body's normal insulating air layer you have on land, gone underwater. Even the compressed air you breathe cools your airways as it expands, contributing to overall heat loss. And of course, your entire body surface is exposed, a huge area for heat to escape.
And that vasoconstriction you mentioned.
Right, vasoconstriction, where your body narrows blood vessels in your arms, legs, fingers, and toes to try and keep the core warm. That's why extremities often feel cold first. And a detail that's often overlooked. At greater depths, the pressure compresses the tiny gas bubbles in neoprene wetsuits, making them thinner and less insulating. So your suit actually works less well the deeper you go. What starts as maybe a refreshing dip can very quickly lead to significant heat loss, especially on longer or deeper dives, or if you're not moving much.
And the serious consequences of that heat loss, as outlined by the guide, are primarily hypothermia, but also, surprisingly, hyperthermia. How does that work?
That's right. Hypothermia occurs when your core body temperature drops below 35 degrees Celsius, or 95 Fahrenheit. In its mild stage, you'll see shivering, pale skin, numbness, maybe some slurred speech, and mild confusion. Standard signs. But here's a crucial point that Dr. Bounds emphasizes. In moderate hypothermia, say around 28 to 32 Celsius, shivering actually stops. Your body's energy reserves are depleted.
Shivering stops. That sounds dangerous.
It's very deceptive and dangerous because the diver might seem calmer, but they're actually getting worse. Confusion deepens, coordination becomes clumsy, breathing gets slow and shallow. Severe hypothermia can lead to unconsciousness, irregular heartbeat, and even cardiac arrest. On the flip side, hyperthermia is overheating, usually less common in temperate waters, but can happen in very warm water or on the boat deck in hot weather wearing a thick suit. Heat exhaustion involves heavy sweating, cold, clammy skin, fatigue, nausea. But heat stroke is a severe medical emergency with body temperatures above 40 Celsius or 104 Fahrenheit. Signs include hot, dry skin, though sometimes sweating persists, a rapid, strong pulse, confusion, agitation, potentially seizures, and a risk of organ failure if not treated immediately, needs rapid cooling.
Wow, okay. That's a lot to consider. What kind of medical conditions, perhaps even surprising ones, increase these thermoregulation risks for divers?
It's a surprisingly long list, actually, and highlights how many things can affect our internal thermostat. This includes hypothyroidism, which lowers your metabolic rate, meaning you generate less body heat. Diabetes is on the list due to potential poor circulation and neuropathy, which can affect your ability to sense temperature changes accurately. Raynaud's disease causes extreme vasoconstriction in fingers and toes, making them very susceptible to cold. Anorexia nervosa reduces insulating body fat and overall heat production. Peripheral vascular disease and chronic illnesses like advanced kidney or liver disease also impair the body's ability to regulate temperature effectively.
What about medications or lifestyle factors?
Good point. Certain medications like beta blockers or sedatives can interfere with your body's normal temperature regulation mechanisms. Alcohol consumption is a big one. It might make you feel warm initially because it dilates surface blood vessels, but this actually increases heat loss rapidly, plus it impairs judgment, which is obviously dangerous underwater. Aging naturally reduces metabolic rate and insulating fat, making older adults generally more prone to heat loss. Neurological conditions like multiple sclerosis or spinal cord injuries can impair the autonomic nervous system's control over temperature regulation. Also, reduced leg finning and some mobility impairments means less heat production from muscle activity. Even having had hypothermia before can make you more susceptible next time. And things like burns and certain skin conditions that impair your skin's insulating properties, and critically dehydration, which affects blood flow and regulation.
So with all those potential factors, what does this mean for proactively managing thermoregulation? Especially if you or someone you're diving with has one of these conditions. What's the practical advice?
Proactive management is absolutely key. It starts with selecting the totally appropriate exposure protection for the water temperature and dive plan. Dr. Downs' guide offers clear guidelines based on temperature ranges. For instance, water 24 degrees C, 75 degrees and above, you might wear just swimwear or a thin 1-2 millimeter suit or skin. As the water gets colder, you need thicker suits. Maybe a 3-5 millimeter shorty for 21-24 degrees C, 70-75 degrees F, a 7 millimeter full suit perhaps for 18-21 degrees C, 65-70 degrees, adding gloves and a hood below that. Below 10 degrees F, 50 degrees F, a dry suit with appropriate thermal undersuits, gloves, and hood becomes pretty much essential for most people to stay comfortable and safe.
So matching the suit to the water is step one.
Definitely. Then, pre-dive preparation is paramount. Choose the right suit, layer up appropriately underneath if needed, and stay warm before you even get in the water. Don't start the dive already chilled. Nutrition and hydration are critical. Eat energy-rich meals beforehand. Stay well-hydrated water is best, and importantly, avoid alcohol or caffeine, which can accelerate heat loss or contribute to dehydration. Limit your exposure time, especially in colder water. Plan shorter dives if necessary. Warm up properly between dives, get out of wet gear, have a warm drink. And consistently monitor yourself and your buddy for signs of cold adjusting gear or ending the dive if needed. If a diver has pre-existing medical conditions that increase heat loss risk, then obviously increased intervention and vigilance are definitely recommended. More insulation, shorter dives, closer monitoring. In emergencies, whether it's hypothermia or hyperthermia, the priority is always to get the diver out of the water safely, call for emergency medical help, move them to a warm or cool environment as appropriate, remove wet or excess clothing, and gradually warm or cool the body while monitoring vital signs like breathing and consciousness.
Okay, great advice. Let's shift our focus now to visual challenges underwater. It's a completely different optical environment than on land, isn't it? What makes seeing clearly underwater so difficult for just about any diver?
It truly is a unique environment for our eyes, yeah. Firstly, light refraction and distortion are major factors. Water has a higher refractive index than air, which makes objects appear about 25-33% closer and larger than they actually are.
So things look bigger and nearer.
Exactly. Divers usually adapt to this perception shift, but it makes judging distances accurately quite tricky, especially initially. Then there's reduced visibility because water absorbs and scatters light much more than air does. The deeper you go, the less light penetrates, and colors start to fade selectively. Reds disappear first, then oranges, yellows. Eventually, everything can look quite blue or green, losing its vibrancy.
Less light, less color.
Right. This leads to color perception changes. That vibrant coral reef might look disappointingly muted at depth. Pressure effects on the eyes are also a concern, specifically mask squeeze. That happens if you don't equalize the airspace inside your mask by exhaling a little bit through your nose as you descend. The pressure difference can cause bruising around the eyes or even burst blood vessels. Without a mask, your vision becomes extremely blurry, almost useless for detail, because the water negates your cornea's normal focusing power. You also face general difficulty judging depth and size accurately. At deeper, low-light depths, you might experience scotopic vision, where you lose color perception entirely and rely on rod cells in your eyes, seeing more in shades of gray. Persistent mask fogging is a common annoyance that reduces visibility. You can also get dazzle from sunlight reflecting off the surface when you look up, and just general eye strain from trying to focus in these challenging conditions. All these common issues highlight why good vision or good correction is so critical for divers.
Okay, so we've covered the general visual challenges anyone might face. But what about divers with pre-existing medical visual problems? How does Dr. Downs' guide suggest they mitigate these specific issues?
Right. When we factor in specific medical visual problems, the guide offers very practical mitigation strategies. For myopia or nearsightedness, which makes distant objects blurry, like seeing your buddy or boat, clearly the solution is usually prescription dive masks with corrective lenses bonded in, or using soft contact lenses, which generally work well underwater.
Prescription masks are common then.
Very. For hyperopia or farsightedness, which affects seeing things close up, like your gauges or dive computer, again, corrective lenses fitted into the mask, often as bifocals or segments or contact lenses, are the way to go. Presbyopia, that age-related difficulty focusing on close objects that affects many of us eventually, can be managed with bifocal or multifocal lenses built into the mask, or sometimes just stick-on magnifying lenses placed strategically inside the mask faceplate for reading gauges. Underwater slates with large print help too. Astigmatism, which causes blurred or distorted vision at all distances, usually requires custom prescription lenses ground to fit the dive mask.
What about color blindness? That seems like it could be tricky.
It can be. With color blindness, which hinders distinguishing certain colors vital for identifying submarine life, reading color-coded instruments, or seeing signals, divers need to rely more on shapes, sizes, brightness, and positions. They should also become very familiar with their own equipment's color coding, maybe by feel or position, and communicate clearly with their buddy who might need to confirm colors if identification is critical for safety or interest. Cataracts, which cause clouding of the eye's natural lens and blurry vision, can often be addressed effectively with surgical removal. After surgery, clearer vision can usually be restored, potentially with corrective lenses and a mask if needed. For glaucoma, a condition that damages the optic nerve, often causing gradual loss of peripheral vision, regular eye exams and consultation with an eye specialist knowledgeable about diving are crucial. Equalizing the mask properly is important to avoid pressure changes, and it's important to note for buddies and instructors. With significant peripheral vision loss from glaucoma, you might only be seen if the diver looks directly at you. They might not notice you approaching from the side.
That's a key point for buddy awareness.
Definitely. Similar issues arise with tunnel vision, where peripheral vision is lost from other causes. This demands extra vigilance from the diver, frequent head scanning side to side, and diving with an aware buddy who understands this limitation and helps monitor the surroundings. Again, the buddy needs to stay more in the diver's central field of view. Conversely, central vision loss, perhaps from macular degeneration, affects seeing objects directly in front, like gauges, or recognizing a buddy's face clearly. This might require enhanced magnification tools for instruments and relying more on peripheral vision for spatial awareness. In this case, interestingly, an instructor or buddy might only be clearly seen if the diver is not looking directly at them but uses their peripheral vision. It presents an almost opposite challenge to tunnel vision.
That's a really comprehensive breakdown of adapting to various visual conditions. But what about those with complete blindness or very severe visual impairment? How does Dr. Downs' guide ensure accessibility for them? It seems like a huge challenge.
It does seem daunting, but this is truly where the guide highlights the incredible adaptability of scuba diving. Blind or severely visually impaired divers can absolutely learn and enjoy scuba diving safely. The challenges in navigation, communication, and environmental awareness are effectively mitigated through specific, tailored strategies. It starts with specialized training from organizations that focus on adaptive scuba, like the Handicapped Scuba Association, HSA, or similar bodies. These offer tailored programs that teach specific orientation skills, buddy procedures, and tactile communication methods.
So specialized instructors and programs are key.
Essential. A crucial component is an enhanced dive buddy system. Diving with an experienced patient buddy, or often two buddies, who maintains very close physical or tethered contact and acts as the diver's eyes, describing the environment and guiding movement. Alternative communication is vital. This relies heavily on pre-agreed tactile signals, specific touches on the hands, arms, or shoulders conveying messages like, okay, ascend, descend, stop, or pointing out something interesting by guiding the diver's hand. Sometimes underwater voice communication systems are used. For orientation and navigation, divers might use tactile compasses or depth gauges with raised markings or follow dive lines or tethers held by the buddy. Maintaining good buoyancy control becomes even more important. Pre-dive briefings become incredibly detailed and sensory. They might involve familiarizing the diver with the site layout using physical models they can touch, or very vivid verbal descriptions focusing on textures, shapes, and expected water movements or sounds. There are also equipment adaptations like vibrating or audible alarms on some dive computers, though sound is less useful if hearing is also impaired, and ensuring all gear has tactile knobs or buttons that are easy to locate and operate by feel. And good surface support is always key, ensuring the boat crew or shore support is aware of the diver's needs and prepared to assist with entry and exit. Ultimately, it's about focusing on safety, comfort, and the unique sensory experience, the feeling of weightlessness, the sounds, the temperature changes, starting in calm, controlled environments and gradually progressing as confidence and skills build. It's a powerful testament to making the sport accessible.
Absolutely incredible. Now, let's talk about our ears. Beyond the general pressure equalization we discussed earlier, which everyone needs to do, what other specific challenges do divers face with their hearing or ear health? And how can they overcome them, according to the guide?
The ears are incredibly delicate, aren't they? And particularly susceptible to pressure changes underwater. Common issues beyond basic equalization trouble include barotrauma, which is tissue damage from pressure imbalance. This can range from mild pain or fluid buildup in the middle ear barotrauma, to more severe issues like dizziness or even ruptured eardrums if equalization fails completely. Eustachian tube dysfunction, where the tube connecting your middle ear to the back of your throat doesn't open properly, is a very common reason for equalization difficulty. It can be temporary, like with a cold, or chronic. A perilymph fistula, which is a tiny tear or leak in the delicate membrane separating the middle and inner ear, is a serious condition. It can be caused by forceful equalization or rapid pressure changes and leads to dizziness, hearing loss, and tinnitus. As the guide stresses, this is an absolute contraindication for diving. You should not dive with this condition due to the risk of permanent damage.
Okay, so that's a definite no-go.
Definitely. Aggressive or forceful equalization attempts can also lead to inner ear barotrauma, IEBT, damaging the sensitive structures of the inner ear directly through pressure transmission, causing vertigo or hearing loss. Other concerns include temporary threshold shift, TTS, a temporary reduction in hearing sensitivity caused by exposure to loud underwater sounds, like boat noise or sonar. Tinnitus, that ringing or buzzing sound in the ears, can be aggravated by pressure changes or existing hearing damage. Chronic otitis media, which is persistent middle ear infection or inflammation, poses a significant infection risk if water enters the middle ear, perhaps through a pre-existing perforation. Exostosis, often called surfer's ear, is bony growths in the ear canal caused by repeated exposure to cold water and wind. These can trap water and debris, increasing infection risk and sometimes making equalization harder. And of course, a ruptured eardrum, tympanic membrane perforation from pressure imbalance or trauma, means absolutely no diving until it's fully healed and cleared by a doctor, usually an ENT specialist. Meniere's disease, an inner ear disorder causing episodes of severe vertigo, hearing loss, and tinnitus, is often considered a contraindication for diving because an unpredictable vertigo attack underwater could be catastrophic. Beyond these specific conditions, any general hearing loss itself can impair communication and situational awareness underwater. The general recommendation from Dr. Downs for anyone with hearing anomalies or concerns is always consult an ear, nose, and throat ENT specialist, ideally one familiar with diving medicine. Practice equalization techniques gently and frequently. Avoid diving with colds or sinus infections that block the eustachian tubes. And consider using specially designed vented earplugs or a pro-ear type mask if recommended by your specialist, though standard earplugs are generally not advised as they prevent equalization.
Okay, so with that background, let's break down the challenges and solutions for specific levels of hearing loss, starting with mild hearing loss. What does that typically mean for a diver in practice?
Sure. With mild hearing loss, divers might find it harder to hear surface communications clearly, especially in noisy environments like a boat deck. They might also miss subtle underwater sounds or acoustic dive signals if used. The solutions include relying more heavily on clear, often slightly exaggerated hand and visual signals. Using dive slates for writing brief messages underwater can be helpful. Ensuring thorough pre-dive briefings where all critical information is visually reinforced, perhaps with written checklists or diagrams, is important so nothing is missed due to mishearing. Equalization can sometimes be more challenging if the hearing loss is related to underlying eustachian tube dysfunction, so adopting a slow descent rate and being meticulous about frequent, gentle equalization is important. Reduced awareness of environmental sounds like a boat approaching overhead or another diver signaling verbally in an emergency means maintaining strong visual contact with a buddy is even more critical than usual. Stay close. Since most traditional dive alarms, like on some computers, are sound-based, using dive computers with prominent visual alerts or vibration alarms is highly recommended. Standard hearing aids are generally not waterproof and must be removed for diving. This means communication on the surface immediately before and after the dive will need visual support gestures, writing, lip reading if possible. There might also be a slightly increased risk of external ear infections, swimmer's ear, if water trapping is an issue, so preventive ear drops after diving or using something like a pro ear mask might be considered after consulting a doctor. But again, standard solid earplugs are usually a bad idea for diving.
Okay, and what about for moderate hearing loss? How do those challenges escalate, and what are the adaptive strategies?
For moderate hearing loss, these challenges naturally become more pronounced. There's likely severe difficulty hearing surface communications, necessitating heavy reliance on written instructions, visual aids like diagrams for briefings, and clear demonstrations. Lip reading might be used if possible, but isn't always reliable. Underwater, there's an even greater dependence on visual cues. Maintaining very close visual contact with the buddy is absolutely essential. Using things like underwater lights for signaling attention, or even physical shaker devices that vibrate might be incorporated into the communication plan. Sound-based alarms on equipment become largely ineffective. Dive computers with strong visual displays, large numbers, bright backlight, and vibration alerts are pretty much mandatory for safety. Buddies need to be fully aware of this limitation and be prepared to get the diver's attention visually or physically. Equalization challenges may be more persistent or significant, possibly requiring consultation with an ENT specialist for management strategies, and always necessitating slow, deliberate descents with frequent equalization attempts. Ascents should also be controlled. The risk of ear infections from water exposure might be higher, especially if there are related structural issues. Using specialized vented diving earplugs, if approved by an ENT or a pro ear mask, could be beneficial, along with meticulous ear drying protocols post-dive. Emergency signals become even more critical. There needs to be a robust, pre-agreed set of visual and possibly tactile emergency signals understood by the entire dive team, buddy, instructor, boat crew. Hearing aids, again, are generally not worn underwater. This means the diver functions as effectively deaf while submerged. Bone conduction hearing devices exist, and some might be waterproofed, but they are expensive, rare, and may have depth limitations, so reliance on visual communication is paramount. This increased reliance on visual cues can also lead to greater mental fatigue during the dive, which needs to be managed.
That really highlights the importance of visual communication. Now, given all that, what's crucial to understand about how cochlear implants fit into this unique underwater world? They seem like a very specific case.
They are a very specific case, and Dr. Downs covers the key considerations well. A cochlear implant system has two main parts: an external processor, which includes the microphone, speech processor, and transmitter coil, usually worn behind the ear, and an internal implant, which consists of the receiver stimulator package surgically placed under the skin and an electrode array inserted into the cochlea. The critical point for diving is that the external component is not typically waterproof and must be removed before entering the water unless it has a specific manufacturer-approved waterproof casing or accessory, which might have its own depth limits.
So no hearing underwater, usually.
Exactly. Without the external processor functioning, the user won't hear anything underwater through the implant. This makes reliance on purely visual communication hand signals, slates, lights, buddy awareness absolutely critical, just as with profound deafness. Pressure sensitivity is another key factor. The internal implant is sealed, but manufacturers usually state maximum pressure or depth limits for their devices, commonly around 20 to 30 meters, roughly 66 to 100 feet, though this varies. Exceeding these manufacturer limits risks physically damaging the internal component due to pressure. Equalization is still crucial. While the implant itself doesn't usually interfere directly with eustachian tube function, the underlying cause of the deafness or the surgery itself might affect equalization ability. Avoiding middle ear barotrauma is vital to protect the entire ear structure, including where the implant sits. Gentle, frequent equalization is necessary. So the precautions are clear. Consult your ENT surgeon, audiologist, and the implant manufacturer to get specific guidelines regarding depth limitations and any other diving contraindications for your particular device. You also need clearance from a dive medicine specialist. Always adhere strictly to those depth limits. Ensure you can equalize effectively and gently before undertaking dives. Rely entirely on visual buddy communication strategies. And diligently protect that external processor from water when not using a certified waterproof solution.
Taste and smell might seem like minor senses in the grand scheme of diving, not something you'd immediately link to safety-critical issues. But how do these senses actually impact a diver's well-being and safety underwater, according to the guide? It seems less obvious.
That's a great observation, and they are surprisingly relevant, though perhaps less directly than vision or hearing. Loss or impairment of taste, agusia dysgeusia, and smell, anosmia aposmia, can stem from various causes we encounter commonly. Viral or bacterial infections like colds, flu, sinus infections, or notably COVID-19. Also, nasal congestion, allergies, head or facial trauma, certain neurological conditions like Parkinson's or Alzheimer's, some medications, simply aging, exposure to certain chemicals or toxins, post-surgical effects, or even congenital conditions.
Okay, so lots of potential causes. How does that link to diving?
The relevance to diving safety is critical in a few specific ways. Firstly, and perhaps most importantly, there's a diminished ability to detect gas contamination in your scuba cylinder. Divers often rely on their sense of smell during initial checks to pick up unusual odors like oil or exhaust fumes in their breathing gas, which could indicate a dangerous compressor malfunction or fill contamination. Without this sense, you could unknowingly inhale toxic substances like carbon monoxide or hydrocarbon vapors, which is a very serious risk, potentially leading to incapacitation underwater.
Wow, okay, I hadn't considered that angle.
Yeah, it's a subtle but vital check. Second, impaired taste can reduce your appetite or enjoyment of food. This might subtly affect your pre-dive nutrition and hydration if you're not motivated to eat or drink properly. Poor nutrition or dehydration, as we know, increases susceptibility to decompression sickness, DCS, and can lead to low energy levels or fatigue underwater. Third, your general awareness of environmental hazards might be reduced. On a dive boat, for instance, the smell of leaking fuel or spoiled food in the galley are important safety cues that someone with anosmia might miss. And finally, there's the potential for delayed detection of underlying infections. Sometimes the first clue you have a sinus or respiratory infection brewing is a change in smell or taste, or nasal congestion you can smell. Missing these early signs could lead you to dive with congestion, increasing the risk of equalization problems and serious barotrauma.
So what are the precautions if a diver knows they have impaired taste or smell?
Precautions focus on compensating for the lost sense. Absolutely thorough pre-dive equipment checks are needed, especially of the breathing gas. Ideally, this check should be performed by a buddy or dive professional with a normal sense of smell. Using electronic air quality monitors or carbon monoxide detectors for tank fills provides an objective safety layer if available. It's also vital to address any underlying causes of the sensory loss before diving if possible, especially if it's related to infection or inflammation. Pay extra conscious attention to maintaining good hydration and nutrition, perhaps setting reminders or following a strict schedule rather than relying on appetite cues. And critically, inform your buddy and the dive leader about your sensory limitations so they can be more vigilant, particularly regarding air checks. As always, consult a dive medicine specialist if the loss is significant or related to an underlying medical condition to assess fitness to dive.
Right. Communication is key again. Okay, let's unpack mobility and stamina issues. What kind of things cause these issues for divers, and how can they maintain optimal performance and safety, especially when facing physical limitations?
Mobility issues underwater can stem from a range of factors. Sometimes it's challenges with buoyancy control being over or underweighted makes swimming much harder. Limitations from ill-fitting or heavy equipment can restrict movement or cause drag. Then there are inherent physical limitations due to fatigue, acute injury, chronic pain, or pre-existing conditions like arthritis, joint replacements, or amputations. And environmental factors like strong currents or surge can challenge anyone's mobility. As for lethargy and reduced stamina, the feeling of just not having the energy for the dive, common causes are simple things like dehydration or poor nutrition before the dive, or lack of general physical fitness, but it can also be linked to underlying chronic medical conditions such as anemia, low red blood cell count, sleep apnea, which causes daytime fatigue, cardiovascular disease, obesity, hypothyroidism, underactive thyroid, or neurological conditions like multiple sclerosis or chronic fatigue syndrome.
And the impact of these mobility or stamina issues underwater.
The impact can be significant. Difficulty with efficient finning, struggling to maintain proper trim and buoyancy, problems managing gear effectively, and just generally working much harder than necessary. This leads to increased air consumption, a higher risk of physical exhaustion, which can trigger anxiety or even panic, and potentially a slower or less effective response in an emergency situation for yourself or your buddy. To manage this, proactive pre-dive preparation is crucial. Eat high-energy, easily digestible meals beforehand, get adequate sleep the night before, and prioritize proper hydration and drink water consistently before, between, and after dives. Physical fitness tailored to diving is key. Regular cardiovascular exercise improves endurance, strength training, especially legs and core, helps with propulsion and stability, and flexibility work, like yoga or Pilates, can improve range of motion and reduce injury risk. Of course, these exercises should be adapted to individual needs and abilities, focusing on functional strength for diving tasks. Dive planning should always be conservative. Avoid overly challenging profiles, like deep dives or strong currents, if stamina is a concern. Pace your dives, plan for sufficient surface intervals to rest and recover, and don't try to cram too many dives into one day. And importantly, get a thorough medical evaluation to identify and manage any underlying conditions that might be contributing to fatigue or mobility issues before you go diving. Addressing the root cause is vital.
What are some of the practical adaptations and techniques specifically mentioned in the guide that can help divers with mobility challenges, perhaps even those with significantly reduced propulsion from their legs?
Yeah, improving mobility underwater, especially when dealing with reduced propulsion, perhaps due to injury, amputation, or neurological conditions, is all about smart strategy and adaptation. Equipment adjustments can make a big difference. Using lightweight tanks or components, ensuring all gear is streamlined to minimize drag, perhaps using different harness systems for better fit and weight distribution. Mastering neutral buoyancy becomes even more critical as it minimizes the effort needed to move or stay in position. Efficient movement techniques are also key, learning how to use currents to your advantage, minimizing unnecessary movements, and adopting energy-efficient finning styles if possible. If propulsion from traditional finning is a problem, the focus shifts to maximizing hydrodynamics and energy conservation. This means meticulous attention to achieving a flat, horizontal body position, trim, to reduce drag.
So streamlining becomes paramount.
Absolutely. And thinking beyond just body position, choose equipment carefully, select fins appropriate for your strength and kicking style. Sometimes shorter, wider fins or specialized adaptive fins work better. Ensure your BCD fits snugly and doesn't create unnecessary drag. Streamline everything, tuck away hoses, secure gauges, avoid dangling equipment. For divers with significant disabilities affecting leg propulsion, adaptive solutions might include using custom prosthetics designed for swimming, relying more on arm strokes using webbed gloves, or employing handheld propulsion devices, DPVs or scooters, which require specific training. Specialized harnesses might be needed to attach gear comfortably and accessibly. Technique is also paramount. Practicing efficient finning if possible, flutter, frog kick, or modified versions, or developing effective arm propulsion techniques. Maintaining that horizontal body position is always key, and practicing slow, deep, relaxed breaths helps maintain buoyancy control and conserve energy in air. Regular training and practice in a pool or calm environment are crucial for mastering these adaptive techniques. Taking advanced courses focusing on buoyancy, trim, and propulsion, or seeking personalized feedback from instructors experienced in adaptive diving like those certified through organizations like HSA or Diveability is highly beneficial. Inclusive training programs often incorporate drills specific to these challenges. And finally, rigorous safety and emergency protocols are essential. Always use a buddy system with clear communication about capabilities and emergency plans. Actively manage fatigue, monitor air and energy levels closely. Take breaks during the dive if needed by holding onto a line or stable object. Practice emergency drills regularly, including out-of-air scenarios and self-rescue techniques, adapting procedures as necessary for specific mobility limitations.
It's amazing how adaptable diving can be with the right approach. Now, beyond these broad categories like vision or mobility, there are a few other critical areas and perhaps equipment advancements that Dr. Down's guide highlights, which can significantly enhance safety and accessibility for divers with specific medical conditions. Can you touch on those?
Absolutely. There are several important miscellaneous points. For individuals with diabetes, managing the risk of hypoglycemia or low blood sugar underwater is a significant concern discussed in detail. The risks include the fact that symptoms of hypoglycemia, like confusion, fatigue, dizziness, sweating, shaking, can be masked by the underwater environment or easily misinterpreted as nitrogen narcosis or just exertion. Critically, you can't easily eat or drink underwater to treat low blood sugar if it occurs. Plus, environmental factors like cold water exposure and physical exertion during the dive naturally increase glucose consumption, making a drop more likely.
So how do you recognize and manage that risk?
Recognition involves knowing your own symptoms well, both the mild ones like shaking, sweating, anxiety, and the more severe signs: confusion, poor coordination, combativeness, eventual loss of consciousness. Management strategies are crucial. First, ensure blood sugar has been stable for at least 24 hours before diving. Check blood sugar immediately before gearing up. Don't dive if it's too low or trending down rapidly. Consider having a small, easily absorbed carbohydrate snack pre-dive if levels are borderline low. Make sure your buddy is fully aware of your condition, knows the signs of hypoglycemia, and knows the plan if symptoms occur. Carry emergency glucose like gel packs or tablets in a small waterproof container accessible upon surfacing. And meticulous post-dive monitoring of blood sugar is also important.
Okay, very important for diabetic divers.
Yeah.
What about spinal injury rescue? That sounds incredibly serious.
It is, and the guide emphasizes extreme caution. Spinal injuries in diving are rare but can result from impacts, like hitting the boat ladder. Severe type 2 decompression sickness affecting the spinal cord falls on the boat deck. Or critically, in individuals with pre-existing neck instability, such as sometimes seen in people with Down syndrome, where even minor trauma could cause injury. Recognition involves looking for signs like pain or tenderness in the neck or back after a potential incident, numbness, tingling, weakness or paralysis in limbs, difficulty breathing, or loss of bladder or bowel control. The key rescue principle is immobilization. Rescue steps focus on calming the conscious diver, immediately supporting the head and neck manually in a neutral position to prevent any movement, carefully stabilizing the diver horizontally in the water, ideally using a rigid backboard or other buoyant stabilization device if available and rescuers are trained. Coordinate a slow, smooth, horizontal extraction from the water onto the board or boat deck. Post-rescue on the surface, continue immobilization. Don't remove heavy gear like the tank and BCD unless it impedes breathing or access for CPR, as it can help stabilize the spine. Administer high-concentration oxygen. Monitor breathing and consciousness closely. Avoid any unnecessary movement and await professional emergency medical services.
Immobilization is the absolute key there. You also mentioned scuba cylinder sizes earlier. How does that factor into accessibility?
Yeah, the choice of scuba cylinder size can be surprisingly important for accessibility and comfort, especially relating to mobility and stamina. Cylinders come in various sizes, typically measured by their internal volume in liters or cubic feet. Small cylinders, maybe 5 to 8 liters, around 30 to 50 cubic feet, are significantly lighter and easier to handle, which is ideal for divers with limited strength, back problems, or endurance issues. They're easier to carry, don, and manage in the water. Standard cylinders, usually 10-12 liters, around 63 to 80 cubic feet, are the most common size used by recreational divers, offering a good balance of air supply and manageable weight for most adults. Large cylinders, 15 liters, around 100 to 120 cubic feet or even more, provide a significantly longer air supply. These can be beneficial for divers who have higher air consumption rates, perhaps due to anxiety or certain respiratory conditions, or for those undertaking dives requiring longer bottom times, or simply for peace of mind. So, for divers with disabilities, considerations include weight management. Smaller cylinders reduce the load on land and in water. Air supply needs. Larger cylinders might be necessary if medical conditions increase air use or if mobility issues slow down the dive. Buoyancy and trim. Different cylinder sizes and materials, steel versus aluminum, affect buoyancy characteristics, requiring weight adjustments. And adaptation of equipment. Specialized harnesses or BCDs might be needed to comfortably secure different cylinder sizes, especially for seated divers or those with unique body shapes. It's about matching the tank to the diver and the dive plan.
It's fascinating how technology and specific gas blends like nitrox can open up diving for more people. Let's talk about enriched air nitrox again. You mentioned benefits. How can this really be a game changer, especially for divers with certain medical considerations?
Nitrox, or enriched air nitrox, EAMX, which is basically just a breathing gas blend with a higher percentage of oxygen than regular air. For example, 32% or 36% oxygen instead of 21%, and therefore less nitrogen, can truly be a significant factor in enhancing safety and accessibility for many divers, especially those managing certain medical conditions. Connecting this to the bigger picture, nitrox can really open up diving. The primary key benefit is the reduced nitrogen absorption during the dive because you're breathing less nitrogen overall. This directly lowers the theoretical risk of decompression sickness, DCS. This reduced nitrogen load is particularly advantageous for individuals who might have compromised circulation, making nitrogen off-gassing less efficient, certain musculoskeletal conditions, or simply those whose bodies might eliminate nitrogen more slowly due to factors like age, obesity, or lower fitness levels. It provides an added margin of safety. Many divers also report reduced post-dive fatigue when using nitrox compared to air for similar profiles. While the scientific evidence for this is sometimes debated, anecdotally, it's a strong perception. This potential benefit could be very helpful for diverse managing conditions like fibromyalgia, chronic fatigue syndrome, or even mild cardiovascular issues where minimizing post-exertion tiredness is desirable.
Less nitrogen, maybe less tired? What else?
Potentially improved oxygen delivery systemically, though the effect is usually subtle at recreational depths. This might offer a small theoretical benefit for divers with very mild asthma, if cleared to dive, slightly reduced lung function, or mild cardiovascular impairments, though it doesn't replace proper medical assessment. A more concrete benefit is longer no decompression limits, NDLs, compared to diving on air to the same depth. This allows for more bottom time without requiring mandatory decompression stops. This can be advantageous for divers with joint or mobility issues who might prefer slower, more relaxed descents, or for those who simply want to maximize their time exploring at moderate depths. It promotes more relaxed dive profiles, which can also be beneficial for managing anxiety. It allows for more customized dive profiles that can help minimize overall physiological stress. This might be considered beneficial when planning dives for individuals with conditions like well-controlled diabetes or obesity as part of a holistic risk management approach. And here's a crucial specific point the guide likely references. For divers known to have a patent foramen oval, PFO, that small hole between the heart's upper chambers present in maybe 25% of the population, which can increase DCS risk by allowing bubbles to bypass the lungs using nitrox while staying shallower than about 15 meters, 50 feet. And importantly, setting their dive computer to calculate based on air diving significantly reduces the nitrogen load and thus the risk of arterial gas embolism or serious neurological DCI. It's a specific risk reduction strategy.
That PFO point is really interesting. Are there special considerations for using nitrox?
Absolutely. It's not just better air. Using nitrox requires specific certification training where you learn about the benefits, risks, and procedures. The main risk is oxygen toxicity because you're breathing a higher partial pressure of oxygen, PPO2. This means there are maximum operating depths, MODs, for each nitrox blend that are shallower than for air, and you must strictly adhere to these depth limits and monitor your total oxygen exposure using your dive computer. You still need medical clearance to dive, regardless of the gas used, and meticulous dive planning is essential, including analyzing your tank contents, marking your cylinder clearly, and programming your dive computer correctly for the specific nitrox blend you're using. But used correctly, it's a valuable tool for enhancing safety and accessibility.
Okay, great overview. We touched on panic earlier as a common problem, but it's so vital, especially in the context of managing challenges underwater, that we revisit it as a comprehensive management strategy. As the guide emphasizes, panic is implicated in so many diving accidents. What are the key signs again, and the steps for managing a panicking diver?
It absolutely is vital. Recognizing the signs of panic in another diver is the critical first step, as they might not be able to signal clearly. Look for that wide-eyed, unseeing, or glazed look. Rapid, shallow, irregular breathing, often audible. Flailing or ineffective movements like jerky swimming or grabbing frantically, clutching at their buddy or equipment, sometimes pulling out their own regulator or yours. Or the most dangerous sign, attempting to bolt directly to the surface. You might also see behavioral signs like ignoring instructions or signals, obsessively fiddling with equipment they perceive as malfunctioning, even if it's fine, or a complete inability to respond or communicate rationally.
So you see those signs in your buddy? What's the procedure?
When managing a panicking diver, your immediate calm and control are essential. Don't add to the chaos. Stay calm. Approach them slowly and cautiously, ideally from the side or behind if they're bolting. Make eye contact if possible to try and establish a connection. Establish positive physical contact. Get a secure but non-threatening grip on their BCD shoulder strap or tank valve, something solid. This reassures them they're not alone and gives you control. Signal them to breathe slowly and deeply. Use slow, exaggerated hand signals for breathe or calm down. Maybe even demonstrate slow breaths yourself if they can see you clearly. Check Check their regulators in their mouth and functioning. If not, offer your alternate air source securely. Control their buoyancy. If they're rocketing up or sinking, use their BCD inflator deflator, or yours if necessary, to stop the uncontrolled movement and establish neutral buoyancy. If they've lost their regulator and are trying to bolt, securing their airway with your octopus is priority one while controlling ascent. Reassure them with simple OK signals and maintain that calm demeanor. Communicate with very simple, direct signals like stop, breathe, look at me, up slowly. Monitor their air supply and depth constantly. Assist their movement towards ascent if necessary, maintaining control. If they regain composure, you might continue the dive very cautiously, but usually the safest option is to end the dive safely with a slow, controlled ascent, performing a safety stop if air supply and conditions permit.
And what about the crucial post-dive procedures after managing a panic incident like that? That must be quite shaken for everyone involved.
Absolutely vital for learning and preventing recurrence. After the dive, once everyone is safely back on the boat or shore, you need to debrief the incident calmly and non-judgmentally. Talk through what happened, what triggered the panic, and how it was managed. This helps the panic diver process the event and understand the triggers. Evaluate equipment and training. Was there an actual equipment issue that contributed? Or does the diver need more practice with certain skills, like mask clearing or buoyancy control, that might have triggered the anxiety? Identifying and addressing any underlying issues is key. And importantly, encourage psychological support if needed. Panic attacks can be frightening, and fear of recurrence can stop someone from diving again. Talking to an instructor, a mentor, or even seeking professional help can be beneficial. Dr. Laura Walton's e-course on preventing panic, which Dr. Downs references in his guide, is noted as a great resource for understanding the psychology of panic and developing coping strategies. It's all about building confidence back up, addressing the root causes, and leading to safer and more enjoyable diving experiences in the future.
That makes perfect sense. This guide really offers a complete framework for dive management, from the physiological basics right through to handling emergencies and adapting for specific needs. Beyond managing known conditions, what's the broader advice for planning for that worst-case scenario? How do instructors or even buddies prepare for the unexpected?
The guide synthesizes it all into an overall framework for comprehensive dive management that applies to everyone, but it places particular emphasis on the responsibilities of instructors and dive leaders, guiding those with specific needs or in challenging conditions. It really boils down to a continuous cycle through 3 phases. First, pre-dive planning. This isn't just about the dive site, it's meticulously assessing the environmental conditions, weather, waves, current, viz. Performing an honest medical self-assessment and discussing conditions with your buddy, selecting the absolutely appropriate equipment for the dive and the diver's needs, and communicating the dive plan and emergency procedures thoroughly with your buddy or team. Second, real-time problem solving during the dive. This is about maintaining situational awareness, constantly monitoring yourself and your buddy, recognizing and responding to early signs of problems or symptoms swiftly, using effective underwater communication, and critically, having the judgment and discipline to know when to modify the plan or abort the dive if conditions change or problems arise. Don't press on regardless. And finally, post-dive recovery and lessons learned. This includes addressing any medical after effects, like ear squeeze or excessive fatigue, thoroughly reviewing the dive outcomes, what went well, what could be improved, and committing to continuous education, skills practice, and regular medical checkups to maintain fitness to dive. It's an ongoing process.
So it's a cycle of prepare, execute with awareness, and review. How does planning for the worst-case scenario fit into that, particularly regarding rescue skills?
Exactly. Planning for the worst-case scenario, as the guide emphasizes heavily for instructors and dive leaders, means actively building and maintaining comprehensive rescue skills and readiness. This starts with prevention and risk management as the first line of defense, conducting those thorough pre-dive risk assessments we just talked about, evaluating the site, weather, equipment, and importantly, diver readiness and fitness for that specific dive, and maintaining vigilance during the dive, constantly scanning, monitoring, and recognizing those early signs of stress or trouble before they escalate. Then, if prevention fails, rescue and emergency response skills are paramount. This isn't just theoretical knowledge, it's practiced ability. It includes underwater rescue techniques like locating a distressed or missing diver, managing an out-of-air emergency, bringing an unresponsive diver safely to the surface while protecting their airway, and performing effective artificial respiration in the water if needed. It also includes surface rescue skills, assisting a panicked or tired diver, proper towing techniques, removing equipment efficiently in the water, and safely exiting the diver from the water. And crucially, proficiency in CPR and first aid, including administering emergency oxygen, which should be available on all dive boats, and familiarity with automated external defibrillators, AEDs.
So hands-on skills are critical.
Absolutely critical. Beyond the physical skills, stress and crisis management capabilities are vital, recognizing signs of stress in yourself and others, employing calming techniques, and making clear decisions under pressure. Good environmental knowledge helps too, understanding potential hazards from marine life or site conditions, and having solid navigation skills to relocate a lost diver or find your way back. For dive leaders, team coordination is essential, being able to direct a rescue effort effectively, communicate with surface support, and implement established emergency action plans, including evacuation protocols. Finally, the guide implicitly underscores the importance of formal certifications and training. This means going beyond basic open water certification. Completing courses like Rescue Diver and Emergency First Response, EFR, or equivalent First Aid CPRO2 provider training should be standard for all serious divers and essential for anyone diving with a less experienced buddy or someone with known challenges. For professionals, advanced training like Dive Master, Instructor, or even Diver Medical Technician, DMT, provides deeper knowledge and skills for managing dive emergencies. It's about being prepared to help yourself and others.
What an immense amount of practical, life-saving insight we've extracted from Dr. Mark Downs, The Diver's Guide to Medical Hurdles. It's just so clear that with the right knowledge, really meticulous preparation, and a strong support system, whether that's a buddy, an instructor, an organization, the underwater world is incredibly accessible and can be made remarkably safe for far more people than you might initially imagine.
Absolutely. And hopefully with this deeper understanding of the physiological changes we all experience, the common challenges anyone might face, and these specific medical considerations and adaptive strategies, you, our listener, can see how potential hurdles can be transformed into manageable situations. This knowledge empowers you not only to navigate the underwater world with greater confidence and certainty for yourself, but also perhaps to be a better buddy or even to help enable someone else you know to experience its unique wonder safely. So the thought to leave you with is this. Consider what aspect of your own diving journey, or perhaps someone else's you might dive with, could benefit most from a more personalized, informed approach to safety and preparation based on what we've discussed today. How can you apply this understanding to make your next dive and future dives even safer and more inclusive?
Well, that ends another podcast. We hope that you now have a better understanding of some of the medical problems that can develop when scuba diving, and also how to manage them. This will make scuba diving not only safer but more enjoyable. Next time we will be talking about how fitness to dive is assessed. We will also delve deeper into how the choice of dive site, the medical condition of the diver, and the competence of the instructor are all factors in making this assessment. We hope that you will join us for this interesting podcast. Until then, safe diving.